those who have opted to attend in person this evening. Right before the meeting began, I did issue a couple of housekeeping items. We are making and collecting public comment on this issue by 3 forms: email, the city's e-feedback form, which is available on the website, and telephone. We will not be accepting, just to keep everyone safe, we are not accepting in-person oral comment this evening. Public comment is not on our agenda for the night. This will be a working session of the Public Health and Safety Committee. We have a couple of options to consider and a couple of reports to receive. That said, the committee will make a recommendation to the Wausau Common Council, who will be asked to decide this issue on November 10th. So any action the committee takes tonight is certainly not final. And the council will take up this matter Tuesday, November 10th. With that, we have two things to consider. As I said, this is a widely debated issue, and it comes to us as COVID-19 numbers in our area have just about quintupled in the last month. That said, I'd like to start the meeting with a couple of presentations, and then we'll go over the 2 options that have been presented in the meeting packets. The first person that we would like to hear from this evening, both of our presenters are attending on WebEx this evening, is the chairman of the Board of Health for Marathon County, Supervisor John Robinson. If we can check in with John on WebEx, welcome.
Well, thank you. And I guess I was prepared to comment more than present. But I would just like to share with you some numbers as it relates to the county. As of today, we have 5,577 cases in the county, of which 3,032 are active, which has strained the capacity of our health department to do contact tracing and reach out to people that may have come in contact with the people that have talk about the specifics of where we are in the county, and it may be more appropriate for me to follow her comments and fill in the areas that she doesn't, because she's working with us on a daily basis.
Sure.
So if
we can
maybe could defer to Joan.
Yep, let's circle over to Joan Toyer from Marathon County Health, and then we'll come back with you, John. Welcome, Joan.
Welcome, everybody. Can you hear me?
We can.
Okay, great. I'm going to give you kind of the big picture, broad brush, and then if you have specific questions, I can definitely answer that. As John has indicated, and as well earlier, COVID is widespread and is uncontrolled in Marathon County and our surrounding counties. And we've been having what I would say is very high activity since mid-September, starting already on September 13th, we had 149 cases, and that is high, very high activity. And this week, or I should say last week, we closed out with well over 1,160 some cases. So you can see that in less than 7 weeks, we have almost 10 times fold of number of cases. COVID, as you probably know by now, most commonly spreads between people who are in close contact with one another. And we always talk about, within that 6 feet. So when we talk about physical distancing, we want to be outside of each other's 6 foot bubble. And it spreeds through respiratory droplets or small particulars produced when an infected person talks, breathes, coughs, sneezes, or sings. And these particles then can be inhaled into the nose, mouth, and cause infection. This is thought to be the main way the virus spreads. And the other thing that is important too to keep in mind is COVID is capable of being spread to others, even if a person doesn't show any symptoms or doesn't feel sick. So the best way to prevent the illness is to avoid being exposed to this virus. And so actions that can be taken to reduce one's risk in being exposed is the social distancing, wearing a mask or a face covering, avoiding gatherings outside of your household, and washing your hands. CDC and Wisconsin Department of Health Services has endorsed the benefits of wearing a face covering, and science shows that wearing a face covering can actually prevent the transmission of respiratory droplets that spread COVID-19. On September 22nd, Governor Evers actually required individuals 5 years and older to wear face coverings when indoors or in closed space and when unable to social distance. And part of the reason for issuing that order back in late September was due to the continuing climb of cases being seen throughout Wisconsin. As health officer, my stance on this is it's important that everyone who can wear a mask safely to wear one. And by wearing a mask, one protects their loved ones, their neighbors, and the community. And it's a simple way to slow and prevent the spread of COVID virus, thereby keeping our schools and businesses open. And as John was stating earlier, in the last 3 weeks or so, our healthcare systems are strained. They are operating under surge plans, and testing at times has also been strained. And testing is one of our key strategies for controlling this, because if you don't know you have COVID, you will continue to spread it. Likewise, because of the significant tenfold increase in cases, our public health system, in terms of our local health department, is also having to institute crisis standards for contact tracing. So we are prioritizing populations, so children, as well as schools, as well as long-term care facilities, and then older adults over the age of 65 are being prioritized in terms of who we outreach to and interview. For all our other residents and businesses, we have been encouraging in the past recent weeks to contact their own close contacts, and resources have been put out on the website to inform people in terms of how to do that. So we are not at the best place. We're not at the place ideally we'd like to see as we're rolling into our upcoming winter months, and knowing that people are going to spend more time indoors, and really needing to ask of people to carry out the behaviors that we know will help control and prevent the spread of this virus. So at this point, I will pause, and I don't know if you'd like John to go next, or if there's specific questions.
Just a question, you know, as a number of us have been in contact with constituents and the public, one thing that has come up in a couple of conversations that I've had with residents is, well, Marathon County is the largest county in Wisconsin. You know, it has a population of roughly 135,000. And so, you know, doing the simple math, if they, you know, divide that into the number of cases we have, I think that, you know, many are believing or of the belief that, you know, that means 3 to 4% of the population has it, and they're spread out over this large landmass that is Marathon County. Obviously, if we were to pass one of these items that's before us this evening, that would be a citywide mask mandate in Wausau. I guess, could you speak a little bit to the Wausau Weston numbers specifically, just so we know, you know, how much of this caseload really is concentrated in our urban community versus in the outlying rural areas of Marathon County? Because it did seem that, you know, just doing that simple division, I think that it did seem to me that a few people I talked to were, you know, perhaps of the belief that things are not quite so bad in the metro area or in Wausau as you might think.
I will refer you all to go on to Marathon County And then when you go to the landing site, you'll see a little banner called COVID-19, and it will take you to a web page, and on that web page is a dashboard. And I would encourage everybody to take a look at, there's actually a map that has census tract data, and it has two maps. One is total cases to date, and then another map looks at cases in the last 2 weeks. I want to reassure everybody that 2 points. 3.9%. Yes, that is a low percentage. But part of the challenge here, what our goal is, we need to control the spread of this virus. If we don't control the spread of this virus, what's going to happen is our healthcare systems are going to become overrun. And when our health systems become overrun, what's going to happen is people who need everyday healthcare will not be able to access it. Also, if we don't control the spread of this disease, our schools will no longer be able to continue in-person learning, and we're going to see businesses shut down because they won't have people to come to work. So the 3.9 is a little misleading because we will see that number continue to increase, but we want to do it so in a very gradual way. Another number that would give us a better picture of really what's happening is rates. And so if you look right now, Marathon County, our ranking in the state is 23 out of 72 counties. And so that ranking is based upon $100,000 population. So it equalizes us. So it doesn't matter where you live in Wisconsin, you can then compare yourself to other counties across the state. In early February, we were ranked 49. We are now at 23. So you can take a look at that in less than a month where we moved. We are now above the state average ranking. So what I would say is we have COVID, it is widespread and it is uncontrolled, and Wausau is being impacted. It's like every other community in Marathon County. And I know John has compiled, and I can provide it too, specific information that would look at Wausau, and you could look at the rankings in terms of how, by census tract, what that ranking looks like.
Okay. If we could circle back then with Supervisor Robinson. Go ahead, John.
You know, it's unfortunate that we're here today because, you know, we're really talking about taking action that if we had responsible behavior, we wouldn't have the spread of the disease. And it is so easy for it to spread when people are not taking the proper precautions. I would like to just touch base on what Joan had said in context of the census tracts. Marathon County currently has 26 census tracts where they're tracking the information, and 10 of those affect the metropolitan area. And generally speaking, most of those census tracts are seeing increases in COVID numbers. So it is a countywide problem with rates going up between, there's information in there from October 4th through 17th, in compared to where they are from 10/11 to the 24th, showing 2-week periods of time. But we've seen significant increases in rates in the county and the total numbers, going up to, again, today, 5,577 cases. And the rate per 100,000 has gone up in the last month from a rate of 1,277 per 100,000, or 1.2 per 100, to over 3,000, or excuse me, 4,081, or cases per 100 in the county. So we've seen a significant increase in that 1 month period of time. Hospitalizations have gone up from approximately 106 to 247. And deaths have gone up from 15 to 61. So we've got this in the county. There's a significant increase in the numbers, and I think we need to look at ways in which we can prevent the spread, try to protect our healthcare workers and others in the community.
Thank you for that. Committee members, do you have any questions for Supervisor Robinson or for Joan Toyer from Health Department? Okay. Thank you both for presenting this evening.
You're welcome.
Thank you.
We do have two options, and let me, I guess, start with a little bit of the background on this. You know that currently our area is under a statewide mask mandate issued by Governor Evers. It's expected that Governor Evers' statewide order, if he does not extend it or is not able to extend it, may expire on November 20th. And so with that coming in just a few weeks, we've had some serious concerns as a community about what that means. And obviously statistics keep pouring in about the fact that were it not for the mask use that we currently have in progress, we would be even multiple times worse than we currently are. And we're already increasing exponentially, like they said, 5-fold in a month. None of us wanted to be in this position. This committee never wanted to be in this position. And as a city, I don't think we ever wanted to be in the position of having to consider such a policy. Obviously, if the Common Council were to choose one of these proposals that we, if we recommend one and send it forward, that local mandate would lie alongside of the governor's mandate and operate in parallel with it. With that, we have two options. A couple weeks ago, the mayor had asked the city attorney's office to begin to do a little research, find out how other communities in Wisconsin have handled this situation. There's a number of communities that have spiraled up way before Wausau did. And so those areas in the southeast corners of the state, we've looked at we've looked at Milwaukee, we've looked at Racine, Whitefish Bay, I believe they've looked at Green Bay, they've looked at some communities up in the north. I think they've maybe looked at Ashland and Superior. There's been a volume of research done to find out first what provisions they've made, and then to gauge the effectiveness of those tools. With that, the city attorney then drafted two options for us. The first one is that you have in your packets is a resolution. When the Common Council issues a resolution, it is a mandate issued by the Common Council, that masks would be worn. A resolution, however, does not carry enforcement provisions or penalties. That is the fundamental difference. Option two, obviously, is a full ordinance that would offer enforcement options and a range of penalties. Obviously, as that ordinance is being enforced, as with any ordinance or local law, the responding officer to the situation has the discretion to decide when he or she will issue a citation or a warning, and that depends on the circumstances of the encounter that they have. It's obviously, and we had some discussion with our police chief about this as well. It was certainly not our goal that either of these provisions, especially the ordinance, would present an undue strain on law enforcement. It is certainly our hope that members of the public would certainly not turn to using this ordinance, if it passes, to report individual violations and create a volume of police calls over singular violations. However, that said, if keepers of public spaces or business owners are working on getting compliance with that mask mandate and they're having difficulties or disruptions that are taking place, obviously we would certainly expect that they would respond to those situations. With that, I think I'd like to hear from our police chief, if he could come up and talk with us a little bit about enforcement. Clearly, they do have a full schedule, and so we certainly understand that violations of this type would certainly not be number one priority when there's, other work that they need to accomplish. So welcome, Chief Bliven.
Thank you for having me, and thank you for giving me an opportunity to speak on this ordinance or resolution discussion. I'm not going to pretend to be an expert on masking and COVID and the spread of COVID or anything like that. I'm not an expert in those things. But you folks do pay me to be your police chief and to have an understanding of our resources and how things like this would impact our resources. So I'll talk about those things. And first and foremost, I think that the thing that's important to recognize is that we are stretched thin already in law enforcement. We have a lot of obligations. Obviously, there's the day-to-day operations of calls for service, 911 calls, domestic violence, traffic enforcement, and those kinds of things. We're experiencing a scourge of mental health issues and AODA issues, and we have a lot of drug issues going on. So we have a lot of things that are on our plate right now. We are trying to help out and lead in terms of some homelessness issues and those kinds of things. So we have a lot of obligations, a lot of things that we have our hands in. And so we don't have the capacity to enforce this ordinance. We just don't have that capacity. For me to say anything other than, if this ordinance would be put into place, for me to say anything other than this would be a low priority for us would be disingenuous. So I want to make sure that the committee and the council understands that we just don't have capacity for this. And in regards to capacity, the other concern I have, I talked with Sheriff Parks today. 2 years ago, we were at the county board asking the county board to fund a couple of actually 6 additional dispatch positions because they're overwhelmed in the dispatch center. And to this day, they've hired some additional positions, but not all 6. So they still have a capacity issue in dispatch. And with an ordinance like this in place, undoubtedly we will have citizens calling the non-emergency number, reporting other citizens for not wearing masks. And so I think that's a capacity issue that you have to take into consideration as well. And the other piece of that is there's a lot of exemptions for medical issues and other types of issues that are carved out within the draft of this ordinance. And one citizen who doesn't know another, who sees them not wearing a mask, doesn't know whether or not they fit into one of those exemptions. So I think that's a concern that I have. Obviously, I think right now, if there's a business that enforces masking at their establishment, at their place of business, and somebody refuses to leave, they can call us already. We don't need this ordinance in place to go and enforce and take action and mediate a situation at a place of business here today. So, we have that ability to respond and to assist businesses if they want to restrict people and make sure that they're following the governor's orders in terms of masking. And I think maybe the largest concern that I have about this ordinance is, there are a lot of protests and debate and discussion around our country, in the state of Wisconsin, even here in Wausau, about law enforcement and what their role is and what they are doing and what they are not doing and how they go about their work. And last couple of months we've been in this chambers at our policing task force meetings talking about law enforcement issues and what we can do to make sure that we are building trust in this community with people that live here. And so I think more than anything, putting law enforcement in the middle of this debate, which is undoubtedly political right now, is a really terrible idea in terms of building trust with people in our community. I think it's going to be very difficult for our officers to handle the situation well when we have, there's going to be people that challenge this ordinance just for the sake of challenging it because they don't like it, they don't believe it's legal, whatever their issue is. And so we're going to respond to situations where people are inside a location not wearing a mask, and they're going to challenge law enforcement. And so now we are the pawn in that battle between government and citizens who don't want to wear masks. And that's a terrible situation to put our police officers in, and I'm really concerned about that. So I think those are my major concerns about this. Again, I'm not a masking expert. I choose to wear a mask, whenever I'm outside, whenever I'm in a business, I'd make that personal choice. I think it's important to wear a mask, but I have serious concern about the law enforcement responsibility in this ordinance.
Thank you for that. Committee members, questions for Chief Bliven? Go ahead, Pat.
Thank you. I was just wondering if Joe's Bait Shop had a customer come in and that person wasn't masked and Joe was uncomfortable and they called the police, and you had this ordinance but without a penalty, would that be a disorderly conduct issue, or how would you handle that?
Yeah, that's a good question. So a lot of municipalities, police departments are handling those types of situations in a similar way, and that is that it is a business's prerogative to operate their business in the way in which they want to. So if they require people to wear a mask before, I mean, Menards is a good example. For months they've required it before the governor's order went into place. They've required people to wear a mask to come into their store. If they have an issue with somebody refusing to leave, refusing to wear a mask, they can call law enforcement. At that point, it's a business. They can tell people to get out of their store, and that becomes a trespassing issue and potentially a disorderly conduct depending upon the type of behavior. So we would go and we would mediate that, and we would do that today. We would have done that prior to the governor's order going into place.
Well, and I think a large part of the concern that we have in the committee is that if the statewide order is not renewed, we are then left with no policy that obligates the wearing of a mask anywhere. And if we're already going up 5 and 10-fold, where does that put us? Assuming that we now have, at least half or perhaps a little better compliance with mask use, we're going up at that rate already. And so, I think that, initially when we began our research on this subject, it was a stopgap, assuming that if the situation in Madison, continues to have the climate that it's had, if that order is not renewed, that leaves, our community with, absolutely no provisions. And that really then, in some cases, there are a number of citizens that are concerned that it really does throw off all the guardrails. So, I think that's a discussion that we need to have as well. I've received a volume of public feedback from my district that, on both sides of the issue, but I have to say, those in favor are outweighing those opposed 2-1, nearly 3-1. And, we've only been accepting that feedback since last Thursday. So, we obviously have 2 more weeks to gather public feedback between now and the 10th. But, when you talk about resources and, a call type being low priority, I guess having worked with the police department as long as this committee has, we would see that low priority to be, the same equivalent as a barking dog call. Or, things that, you're not going to, if someone calls in, you're obviously, and complains that they just left, a business and, half the people in there didn't have a mask, no one is going to expect the police department to respond lights and siren to an anti-masking call. I mean, that is not our expectation. We're certainly realistic about that. I think that we need to talk through both alternatives and decide which direction we want to go. But committee members, any additional questions for the chief? Okay, thank you for that. I also want to take some time to get some comments from the mayor. Mayor, go ahead.
Thank you. So obviously, this has been a discussion I've been having with you, Chair, with the chief, with our attorney, with everybody here. And I guess it started because, I don't know any CEO of any company that would be okay with 9% of their workforce out because of COVID. It really does put a strain on what we're trying to do here. So, trying to keep our workforce safe, trying to keep the people in our community safe. I just listened to the Aspirus Senior Vice President and the President of Regional Markets, Jesse Tischer, and he shared this on Friday that 1 out of 52 Marathon County residents has an active infection. Now the average of Wisconsin as a whole is 1 out of 129. So this isn't good for us. This is bad. So this is coming from a place of needing to find solutions. I realize that having the police enforce it doesn't maybe meet the goals of our community. So I've been calling around to other mayors about what they're doing. And one of the mayors I talked to was the mayor of Superior. And they've had a resolution, I want to say before the governor's order. And what they were doing is kind of pushing that onus onto the business owners. Obviously, the authorities are already authorized to pursue trespassing and things like that if people won't leave and aren't wearing a mask. But they also created signs with the city's logo on it for businesses to put up to kind of put a little extra city pressure behind that. They also, I want to see here. I took some good notes here. Their public health and safety committee, much like ours, regulates their licenses. So if a business has a license, they're expected to comply with that order. And if they are a business that gets incentives from the city, any kind of money, loans, grants, things like that, they're also expected to comply. So they've got widespread compliance just based on the relationship that the businesses have with the city. So that might be something to pursue. The mayor gave me a couple other tips on how he worked with police and business owners together to make this happen. And, when we ended our conversation, he said, who are you really enforcing this against? And when I thought about it, it's not really enforcing against something. It's protecting for the people of Wausau. So that's the way I'm looking at this. We got to do something. We got to get the infection rate under control. It's not good.
Well, I was a little bit concerned in the lead up to this meeting when I turned on the news on one of our TV stations late last week, and found that, that reporter had interviewed with you, Mayor, and found out that apparently emergency management had informed our mayor that the first of our refrigerated mobile morgue trucks had arrived. And, who would have thought we'd have been in that position? I would love to go back to when Marathon County had 6 cases, but we are way, way, way beyond that. And, we're getting to a point where everyone knows someone who has either been affected, has been sick, has been waiting on a test, knows someone who had, either no symptoms or some symptoms, and many know someone who has died. And, where does that put us? Where are we going to be 6 months from now? We need to get to a point where we had the curve flattened at the end of May. And between then and now, we are pretty much the opposite. So, that's, I think, what I'd like us to talk through as a committee, looking at both options. And we asked that you be given the choice between a resolution or an ordinance. You certainly can, pick one or the other, and make a recommendation to the council based on. I think we have to operate cautiously with the assumption that the governor's order may not renew. If it does, this is less of an issue. This obviously would lay alongside of a statewide order, but in the absence of a statewide order, where does that leave Wausau? And so, I'm interested in your thoughts, committee members, as far as where you're at in this conversation. Go ahead, Pat.
I have a question.
Certainly.
In both the ordinance and the resolution, there's a clause that requires people, if they're outside of their own home, to have in their possession a face covering. And I'm just wondering why that was included. If somebody's, say they're walking their dog in their neighborhood, or if they're going to, visit the cemetery or something like that, why do they need to have a face covering? Is that a potential enforcement thing where the enforcer would constantly hear, well, I forgot? Are we trying to get people to habituate to putting a mask in their pocket? Or why is that in there?
Well, we have the city attorney in attendance tonight. She did the research and drafted this for us. I guess, Ann, would you be willing to offer us some insight based on your research?
I did copy the Green Bay ordinance, Alder Peckham, but I think that further clarifies that you don't need them when you're in your own home, but you do need it with you, or unless you're going to borrow one from somebody or have somebody give one to you, but it's just a further requirement that you have one on you when you leave your home, because you're going to be required to wear it when you get to any indoor area accessible to the public or in transportation for hire where you're within 6 feet of another individual that's not a family member or a member of your household. Does that answer your question? Just further clarifies that
Answers
you
the
need to have
question,
it.
but I think one of the things we need to do is make sure that this is the least extreme version while conveying a clear message to the community that mask wearing is good. Forcing somebody to have one in their pocket when they may not be going into another building or indoor space, I'm not sure that's necessary. So trying to just make sure we don't come across as being overly intrusive.
We could strike the words starting with shall have possession of a face covering when the person leaves home or other place of residence, and we could strike up to there so it reads, any individual 5 and older who is present in the city of Wausau shall wear a face covering in indoor areas.
Is the chair ready for a motion on this?
I'm ready for, I'm ready for a motion, and at that point, we can make some amendments if you wanted to make the amendment that you've, yeah, go ahead. If you're ready for a motion, you move to accept one or the other, and then we can amend if you wish.
Oh, I thought you were going to have a separate issue of resolution. You wanted
Okay.
a motion to
Well-
either do a resolution or do an ordinance.
Well, the committee has, as far as I see it, 4 options. The committee can choose to do nothing. It can choose to forward a resolution. It could choose to forward an ordinance, or it could choose to forward both items and make the council choose. Obviously, that defeats the purpose of us vetting the plans to make a recommendation to them based on our research and the presentation. So, it's certainly an available option, but it's a less desirable one for us to kick that can down the road. So I think the rest of the council would appreciate us sending something, and not this whole issue, to them without the vetting that they expect us to do. So, yes, the ordinance and the resolution seem to be worded very similar, other than the penalties and the enforcement segments. But if we want to also talk through the resolution first, we certainly can do that, and then you can make the amendment to whichever one you choose.
Yeah, I see Ms. Herbst wants to speak, but
Yes.
I guess maybe it would be prudent to send a resolution to the council, and if the council feels, that's going to be, 8 days, I guess, before we meet, is that right? Mm-hmm. If the council feels at that time that they want to switch back to the ordinance, I think they could do so quite easily. If they did decide to stick with the resolution, and we're, a couple of weeks or a month into it, we can always switch back to an ordinance at that point too. So I guess my inclination would be to go with a resolution
Okay?
with the, and I would make that suggested amendment
Okay.
at that time.
Okay, let's circle back with Ms. Herbst here. Go ahead, Don.
My only comment was I.
Oh, microphone, sorry.
I got the blue light on. One or the other, it's been that kind of a Monday. I guess right now, and we haven't talked about the resolution, I guess my thinking is, what is the lesser of the 2 evils? Okay? So we haven't talked about the resolution yet, we just talked about the ordinance. So yeah, I would be happy to hear about what's involved with the resolution, please.
Okay.
Even though I know I've read it.
Yep, and so we'll shift gears, and Ann can talk to us also about a resolution and the difference between the two. Obviously, she drafted both.
Yep.
As I mentioned before, the resolution carries similar exemptions and similar requirements, but it does not have provisions in it for law enforcement activity or money penalty forfeitures. Go ahead, Ann.
And I think you covered it, Lisa, very well. It's very similar to the one the council passed on September 22nd, requiring mask wearing in all government-owned facilities, except this one would apply citywide. and be much like the governor's order, although the governor's order should be enforced by the county health department. This one would not be enforced at all. So it just says that the mayor and the council resolve that everyone shall wear a face covering with the exception of those exemptions. And that's pretty much it. So it's just a statement. And there's no enforcement mechanism. That's the difference between a resolution and an ordinance.
And the end of the resolution does, in the be it further resolved at the end, does indicate that all businesses, organizations, and nonprofit entities within the city are encouraged to post notices requiring employees, customers, visitors, members, or members of the public to wear a face covering whenever persons are in a building open to the public. And so, as the mayor said, if you were, wanting to shift some of that responsibility to obligate entrance into those facilities to mask, the wording of the resolution does trend that way, more than what the ordinance does, just based on the way it closes itself out. Go ahead, Dawn.
Then I absolutely would.
Oh, I think you turned your mic off, sorry. You were louder before.
When I sit in my own chair, that is the problem.
That's the problem.
Okay, I'll get through this tonight, bear with me. I really am in favor of the resolution. I don't really think that we need to get law enforcement involved and penalties. I was just reading somewhere that Father Bob from St. Anne's was fined $300 because he did not have his mask on while doing his duties. I guess then my question is, where's the money going? What is it going to? I don't think we need anything other than a resolution. Thank you.
Thank you for that.
There is a caller with their hand up. I didn't know that was possible. I don't know who the caller is, so that will be left up to you.
Okay.
No, they're not.
Yep, it's, okay, so we can't identify the caller. Go ahead, Mr. Peckham.
Thank you. I'm wondering, this is going to go, upon passage, would go into effect immediately, or this would kick in when, if the state's mandate or executive order lapses?
Normally, they're immediately after publication, so probably by the end of the week following the council meeting, or you can set a date.
Yeah, you could decide. You could say that it doesn't go into effect until an expiration, or you could do what you want.
One of the objections I was hearing was, we don't need this on top of the state one. And that made sense, and I said, well, I don't think we're going to do that. So, yeah, I think they would be, if we can get done what we want to get done, I think we should have the state's order remain in effect. Obviously, we don't have any control over that, but have this kick in if the state's order lapses.
Go ahead, Ann.
I will simply point out that there are places that do have them overlapping, and you can have an order that's more restrictive than what the governor's mandate requires, but you can't have one that's less restrictive because the state order takes precedence. So you could have one,
Is this
but,
more restrictive?
or the same. It's drafted very closely along the same. I would say it's not more restrictive because I left out the entire section about holding business owners accountable for keeping people coming into their businesses wearing masks, so that was left out of the draft ordinance.
Okay, and your attorney
And that's not in the
opinion,
governor's
is there
order
any-
either.
Is there any difficulty in us having this kick in if the state one would lapse?
Not at all. That's, you can designate, as Lisa said, the event upon which it'll take effect, or a date upon which it'll take effect, and you can set when it sunsets, or a date certain that it expires, or you can tie it or tie it to a trigger, like when a governor's order expires, this expires, or when our health emergency is terminated by the council, this resolution would expire. So you can set both the effective date and the ending date.
Very good.
Okay. Committee members, additional committee member comment or questions? Okay. And so, okay, let me see if I understand this right, Mr. Peckham. So you were interested in a resolution that would remove the provision that requires a person to have the mask in their possession when they're away from home, which would strike the sentence that the city attorney identified. It sounded like you were heading toward taking effect upon the expiration of the governor's statewide mandate. And then we would need to also pick a sunset date. So you can have that date be, as the city attorney said, to terminate with the end of Wausau's public health emergency that the mayor declared on Friday. Or you can pick a date certain, and, obviously at that point, you could reevaluate if you would need to then renew such a provision. And obviously, the common council would resolve or reserve its right to discontinue this early if numbers trend downward faster than anyone expected.
Can I wrap all that up in one little package?
For sure, if you'd like.
Okay, so you've summarized that well. I would move to pass and send to the city council the resolution that's before us with the change to remove the carry requirement and have it go into effect upon the lapse of the state ordinance, if that occurs, and to remain in place until January 31st, unless the council decides to terminate it earlier.
Okay, so January 31st of 2021.
Yes.
Okay. Do we have a second for Mr. Peckham's motion? Second for Mr. Peckham's motion? We'll need to take a vote on. Is there a second for Mr. Peckham's motion to move forward a resolution and not the ordinance? Okay, we have a motion by Herbst, or a second by Herbst. With that, then the only item proceeding to council for November 10th would be the resolution. And the resolution then would take effect upon the lapse or expiration of the governor's statewide order and would sunset on 1/31 of 21. And then we would thus then remove the language that compels a person to carry said mask with them. Any additional comment or questions from the committee?
The only thing
Go
I
ahead.
would, thank you. The only thing I would say is that we still have the ordinance. It's written up and ready to be considered by the full council. And so let's start with this and, go from there.
That is an incremental step that this committee has pursued before. We all have always tried to sometimes take the less invasive measure first, obviously gauge its effectiveness. Hopefully we don't need this. If the governor renews his order, then, this would sit in waiting. But if not, we'd certainly have this as a fail-safe, and we could certainly gauge its effectiveness. But like you said, the legal work surrounding the ordinance is there, and it certainly would be available if we would decide that, another measure would be necessary. So with that, with a motion, go ahead.
Lisa, I just wanted to comment that so far from the people that I've heard from in my district, I'm at 3-1 that do not want this mandate.
Okay.
So just
Well,
wanted to throw
and
that
I
in
think
there.
it's important that we all record that feedback also, and I was going to mention that as council members, we do need to record the feedback that's coming from within our districts. Obviously, each one of us was elected to represent roughly 3,000 people, and so given that, we do need to accurately reflect that feedback. So keep track of the feedback you're getting from within your districts. Personally, I've been taking care to verify where that feedback is coming from. I've received a volume of feedback from outside the Wausau area. Obviously, that needs to be weighted accordingly because we are looking at a policy for Wausau to serve Wausau's residents. So, but separate from that, it's important that we have that feedback and that we kind of bring some of that along on November 10th. And then also, by then we'll have some e-forms that we can pour over, and we'll also have then our email and our telephone contacts that we can kind of report out on as well. Mr. Peckham.
Yes, thank you. And I would like to say a couple things. I think the e-form mechanism is working very well, both for internal ease of handling, and I think citizens seem to be comfortable submitting their opinions that way, and I think that's a very good step that we've taken. And just for the public's information, I did track, the city clerk has received more than 100 of those e-form comments, and I haven't gotten through every one of them, but I just decided to start counting them and putting them into columns until I got to a pretty good sized number that might tell us something. And so I have, I stopped when I got to 50 in one category, and that happened to be yes. So there were 50 people is where I stopped counting, and I noted where I was so I can resume. But I have 50 yeses, 12 noes, and 2 that were kind of iffy or confused. So at that rate, the comments coming in that way are 4-1 in favor of passage for this thing. And a surprising number also were perfectly happy and actually encouraged us to have some enforcement mechanism. So if it does come to that, I will be supportive of it.
Okay. Thank you for that. And we'll also have time to pour over those feedback sheets once we get them. The clerk will obviously present those to the council so they can have them for their reference prior to that meeting. So with that, this is the only item on our agenda tonight with a motion and a second on the floor. We'll take a roll call vote because we have one member that has joined on WebEx. So we'll call the roll. McElhaney? Oh, put your mic on, please, sorry.
But no.
Okay. Peckham?
Aye.
Herbst? Aye. Wadinsky?
I vote no.
Okay, and I'll vote aye. We'll let the record show then that that resolution would go forward on a recommendation of 3-2. November 10th then, the Common Council will take up the issue. We'll provide them our information from tonight along with the minutes and all of the comment that's received. So anyone from out in the public that still wants to comment, feel free to call your alder, email them. All of our email addresses are on the city's website, and the e-form is also available on the city's website. So that is a good way to communicate your thoughts. We do read them all, so feel free to use those tools, and we've got 8 days to do that. So thank everyone for coming tonight. This was a special meeting, so thank you for making time for this. I think it's an important issue, and we'll then take a motion to adjourn. Motion by Herbst, is there a second? Second by Peckham. Members in favor signify by saying aye. Aye. We'll stand adjourned, and good night, everyone. Thank you.